Hi, hello friends, good morning. Welcome to our channel, The Voice of Nurse. Today, our new beginning subject from the nursing point of view. The subject name is Community Health Nursing. Today, we are going to discuss related to the community health nursing and very important questions related to the community health nursing in previous years FAQs also we are going to discuss today. Before moving on to topic, till now what we finished, just we will remember once. Till now we successfully finished related to the subject nursing point of view: nutrition, midwifery and gynecology, anatomy and physiology, nursing foundation, medical surgical nursing, mental health nursing, first aid, pediatrics, child health nursing, and recently we finished microbiology subject also. Approximately we finished all subjects. According to the subject wise, we finished first set of 100 questions. Not only subjects related to the nursing point of view, we already discussed related to the NHM 2022 two sets question papers with explanation, and NHM 2023 this year January question paper also we discussed, and related to the MHSRB question paper 100 marks question papers model paper we already discussed in previous videos. Now in today class we are going to discuss related to the community health nursing. Before discussion of the topic, a small request friends. Anybody watching first time my channel, please subscribe my channel, give a like and share the video to your friends. Please share your opinion in comment section. Let's move on to topic. Today we are going to discuss community health nursing part 1. In part 1 we are going to discuss related to the community health nursing introduction, definition, community health nursing process, health assessment, epidemiology, and in epidemiology methods, principles of epidemiology, objectives, family health care system and healthcare team, and along with these topics plus FAQs, frequently asked question in previous years related to the community health nursing. Today we are going to discuss along with the introduction. Now we are moving on to introduction point of view. Community health nursing introduction. The WHO defines community health as environmental, social and economic resources to sustain emotional and physical well-being among people in ways that advance their aspirations and satisfy their needs in their unique environment. Introduction. According to WHO defines community health as environmental, social and economic resources sustain emotional physical well-being among with people ways of advance their aspirations and satisfying their needs, daily needs and unique environment related to the community. This is the introduction related to the community health nursing according to the WHO. And community health nursing is a population focused, community oriented approach aimed at health promotion of an entire population and prevention of disease, disability and premature death in a population. The child health nursing deals with the population focused on community oriented approaches aimed at health promotion of entire population and also prevention of diseases, disability and premature death in a population. As a community healthcare nurse, we have to provide care to the people who are ill and entire population and we have to prevent the disease condition, reduces the disabilities and premature death in a population we have to reduce. Community health services should be provided directly or indirectly to individuals, family or community. So through the direct and indirect methods we can provide care to the families and individuals in the community levels. Till now we discussed related to the introduction of community health nursing. Now we are going to discuss definition of the community health nursing. In introduction point of view only, we discussed related to the definition. Community health nursing is a population focused, community oriented approach aimed at health promotion of entire population and prevention of disease, disability and premature death in the population. Now we will see the community health nursing process. The community health nursing process: as a community health nurse, she or he should organize the 5 sequential and interrelated phases. As a community health nurse, we have to sequentially arrange 5 sequentially arrange interrelated phases. Those are assessment, diagnosis, planning, implementation and evaluation. Nothing but care plan. Like care plan, we have to provide quality of care to the population or in the communities. That's why we had to arrange the subsequential and interrelated phases like assessment, diagnosis, planning, implementation and evaluation. Here no need of explanation related to the assessment, diagnosis, planning, implementation, evaluation. We all know about these things. No need of explanation. Next, we will see what is health assessment in community. Health assessment in community. A health assessment is a plan of care that identifies the specific needs of a person and how those needs will be addressed by the healthcare system or skilled nursing facility. The health assessment is a plan of care that identifies the specific needs for a person, how those needs will be addressed by healthcare system by skilled nursing facility. We have to assess the needs of the person or individuals. Health assessment is the evaluation of the health status by performing a physical exam after taking a health history. So, health assessment is a evaluation of the health status by performing a physical examination after taking a health history related to the subjective data and objective data. Then we can go for the physical examination of the client. The health assessment, like the community health assessment, like collect data, analyze the data and develop report and disseminated findings and form advisory group. When we are dealing in community health assessment, then we have to assess the client and we have to take a health history, means we have to take a health assessment from the client through the collection of data and we have to analyze the data and then we have to develop the report, disseminate finding, form a advisory group. These all are the comes under community health assessment in the community health nursing. Now we will see the epidemiology. What is epidemiology? Epidemiology is the method used to find the causes of health outcomes and diseases in population. The word epidemiology is a branch of medicine which deals with the incident, distribution and possible control of diseases and other factors related to the health. Easily, literally, epidemiology means the study of what is upon the people. Nothing but what is upon the people. The study of what is upon the people. And in epidemiology, the patients is the community and individuals are viewed collectively. This is epidemiology. Uses of epidemiology to study the effects of disease state in a population over a time and predict future health. In the epidemiology uses like study of effects of disease state. Before itself, we can predict the condition and predict the future health of the population through the epidemiology. Now we will see the epidemiology methods. Epidemiology methods are analytic method, experimental method and descriptive method. The first method is analytic method. The second one is experimental method. Third one is descriptive method. These all are the three methods is in epidemiology. Now we will see the principles of epidemiology and objectives. The principle of epidemiology. Epidemiology is concerned with the frequency and pattern of health events in a population. So, the epidemiology is concerned with the frequency and pattern of health events in a population. Objectives: determine the extent of disease, study the progression of the disease. Objectives like the determine extent of disease and study the progression of the disease, and evaluate preventive and therapeutic measures for a disease or condition. It develops public health policies. So, we can evaluate the preventive measures and therapeutic measures for a disease or condition. We can develop say public health policies. These all are the principles of epidemiology and objectives of epidemiology. Next, family health nursing care. What is the family health nursing care? Family health nursing is a care or service provided to the family members for the prevention, promotion and maintenance of physical, mental, spiritual and social health for the family unit and the individual family members irrespective of age and sex. Nothing but family health nursing care means providing a services or care to the family members to prevent, promote and maintenance of physical, mental, spiritual and social health for the family and also individual family members irrespective of age and sex. Also we have to provide services or care to the family members. Next, health team in community. Health team in community: physician, national social workers, health assistants and theirs, village health guides, panchayat leaders, teachers, postmasters, women health leaders. Along with this team consists of family, the community health nurse and healthcare professional like physician, nutritionist, social workers, female health workers and Anganwadi health workers and voluntary health workers. These all members also comes under health team in community, and important members of healthcare team are physician, registered nurse, pathologist, pharmacist, radiologist, dietitian and social workers, other allied healthcare members. These all are the important team members in health team in community. These all are comes under the healthcare system also in the community levels. These are the community health nursing introduction, definition, community health nursing process, health assessment and epidemiology, epidemiology and epidemiology methods, principles of epidemiology, objectives, family healthcare system and healthcare system. This is part 1 related to the introduction about community health nursing. Today we will discuss along with introduction of the community health nursing plus FAQs also. The first question is, how many health workers are posted in each subcenter? How many health workers are posted in each subcenters? Option A 6 members, option B 4 members, option C 2 members, option D 3 members. In each subcenter is required to be managed by at least one auxiliary nurse midwifery means ANM or female health worker and one male health worker means each subcenter is required to be managed by the at least one auxiliary nurse midwife or female health worker, one member and one male worker. Under National Rural Health Mission NRHM, there is a provision for one additional second ANM on contract basis. So, how many health workers are posted in each subcenter? Means 2 members is the correct answer here. Option C. In subcenters, the health care workers have to provide assigned task relating to interpersonal communication in order to bring about behavior change and provide services in relation to maternal and child health, family welfare, nutrition, immunization, diarrhea control programs, and control of communicable disease programs. They have to provide care to the peoples in the community. So here the how many health workers are posted in each subcenter is option C, 2 members is the correct answer. Next we will move on to question number 2. Community health also called as, the community health also called as, we will see options. Option A community medicine, option B public health, option C public medicine, option D all of the above. Community health refers to simple health services that are delivered by laymen outside hospitals and clinics. Community health is also the subset of public health that it tied to and practiced by clinicians as part of their normal duties. Community health is actually considered as a subdiscipline of public health. Community health also called as community medicine, public health, public medicine. So here in these options, option D all of the above is the correct answer. The community health also called as community medicine, public health, public medicine. Option D is the correct answer here. Next we will move on to question number 3. Which of the following levels is not included in main link of health system? From the option, one is not included in main link of the health system. We will see here options. First option A central level, option B local level, option C regional level, option D state level. All the state level, the healthcare delivery system is under the State Department of Health and Family Welfare, and central level healthcare administration, the official organ of the health system at the national levels. Local level implementation of local government code of 191 resulted in the devolution of health services to local government units. So, state level, central level, local level, these levels or comes under the main link of the health system. So, here regional level is not included in the main link of healthcare system and health system. So, here option C is the except here not linked in health system. Next we will move on to question number 4. The Indian Red Cross Society was established in which year? Which year the Indian Red Cross Society was established? We will see here options. First option A 1952, option B 1920, option C 1940, option D 1980. A bill to constitute the Indian Red Cross Society independent of the British Red Cross was introduced in the Indian Legislative Council on 3rd March in the year of 1920 by Sir Claude Hill. The act was last amended in the year of 1992 and of rules were formed in 1994. The Indian Red Cross is a voluntary humanitarian organization having a network of over 700 branches throughout the country, providing relief in times of disaster or emergencies and promotes health and care of the vulnerable people and communities. So, Indian Red Cross Society was established in the year of 1923 March by Sir Claude Hill. Act was last amended in 1992 but established in the year of 1920. Here in these options, option B is the correct answer. Next we will move on to question number 5. A written order for supplies and equipment or for their repair is means a written order for supplies and equipment or for their repair is termed as in the medical. Options: Option A, inventory. Option B, indent. Option C, requisition. Option D, all of the above. We will see one by one. Inventory. What is means inventory? The word inventory means nothing but a detailed list about the some of the content or objects or medicines. We will see what is inventory in detail about. Inventory is refers to all the items, goods, materials held by a business for selling in the market to earn a profit. This is called as inventory. Next we will see what is indent. To start a line of writing further from the left hand side of the page than the other lines. Indent means, for example, some of in the hospital setup we can indent some of the medicine for the client, that is nothing but indent. Here a written order for supplies and equipment or for their repair is called as requisition. An official order paying claim to the use of property or materials. Requisition is a request for goods or services made by an employee to the person or department in a company that is responsible for the purchasing. For example, for the requisition is a purchase request for 10 laptops. This is example for the requisition. So here in these options, option C is the correct answer, requisition. Next we will move on to question number 6. In the communication process, a receiver is. In the communication process, receiver is. What is the receiver role? We will see here options. Option A, the person who decodes a message. Option B, a message pathway. Option C, the person who encodes an idea. Option D, sender. The receiver is the individual or individuals to whom the message is directed. A receiver is the individual or individuals to whom the message is directed, and the receiver is also known as communicate. It may be a person or group of people to whom the message is conveyed. The message must be designed, encoded and transmitted in a manner that receiver can understand it easily. Depending on the channel selected, receiver may be listener, viewer or a reader. So, according to the communication process, the receiver is person who encodes an idea. So here in these options, option C is the correct answer. According to communication process, the receiver is person who encodes an ideas. Next we will move on to question number 7. Gold standard in conforming. Gold standard in conforming the diagnosis of malaria is. What is the gold standard in conforming malaria diagnostic test? We will see here options. Option A, radio immunoassay. Option B, polymerase chain reaction. Option C, peripheral blood smear examination. Option D, ELISA, ELISA. The word ELISA, ELISA means enzyme linked immunoassay. Enzyme linked immunosorbent assay. The malaria parasites can be identified by examining under the microscope a drop of the packed blood spread out as a blood smear on a microscopic slide. It is useful in the establishing the diagnosis of malaria. Microscopic examination remains the gold standard for laboratory confirmation of malaria. This test should be performed immediately when ordered by healthcare providers. The examination of Zimesa strained peripheral blood smear is the standard test for the diagnosis of malaria infection. It is useful in establishing the diagnosis of malaria, identifying the plasmodium sap, as well as the determining the degree of parasitemia. Also, we can identify in the peripheral blood smear examination. So here the gold standard in confirming the diagnosis of malaria is option C. Peripheral blood smear examination is the correct answer here. Option C. Next we will move on to question number 8. Which of the following course for community health officer? From the option, which one is community health officer for course? We will see here options. Option A, DCHN. Option B, BPHN. Option C, BPCCHN. Option D, BCHN. What is the role of community health officer in the community? Clinical functions to provide ambulatory care and management. Public health functions for health promotion, prevention and disease surveillance. The role of community health officer in India: screening, prevention, control and management of non-communicable diseases, and screening of above 30 years for 30 years age people should be checked for hypertension, diabetes, oral, breast or cervical cancers. Referral for the all suspectable clients to the medical officer or specialist for the early diagnosis and further treatment. Here DCHN, option A, what is DCHN? DCHN means diploma in computer hardware and networking. So here option A is not related to the community health nursing. Next option B, BPHN. BPHN means Black Public Health Nurse, Bachelor of Public Health Nursing. Black Public Health Nurse or Bachelor of Public Health Nursing. This is related to the nursing, not health officer. Next option C, BPCCHN. BPCCHN means Bridge Course Program on Certificate in Child Health Nursing. Means here option C is the correct answer. Bridge Course Program on Certificate in Child Health Nursing for the officers. So here option C is the correct answer. The course of community health officer is BPCCHN, Bridge Course Program on Certificate in Child Health Nursing. Here option D, BCHN means Bachelor of Community Health Nursing. So this is all not related to the community health officer. So here option C is the correct answer. Next we will move on to question number 9. The rashes of the chickenpox first appears on. The chickenpox rashes will appears in the first sight. We will see here options. Option A, legs. Option B, arm. Option C, chest. Option D, abdomen. The rash may first show upon the chest and back, then face, then spread over the entire body, including inside the mouth, eyelids or genital area. The chickenpox appears 10 to 21 days after the exposure of varicella zoster virus. The rash often lasts about 5 to 10 days. Other symptoms that may appear 1 to 2 days before the rash includes fever also. The chickenpox is caused by varicella zoster virus. Chickenpox often starts without the classic rash with a fever, headache, sore throat or stomachache. These symptoms may last for few days with the fever in the range of 101 degree Fahrenheit to 102 Fahrenheit. The red itchy skin rash usually starts on the chest, then belly or back and face. So here the rashes of chickenpox is first appear on the chest. From the following options, option C is the correct answer here. Next we will move on to question number 10. The ESI Act was passed by the Government of India in the year. ESI means Employee State Insurance. The ESI Act was passed by the Government of India in the year of. We will see here options. Option A 1982, option B 1948, option C 1968, option D 1962. The promulgation of Employee State Insurance Act in the year of 1948 by the Parliament was the first major legislation on social security for workers in independent India. The founder of ESI is Elian D. Ronway and Jacques Dobus, Iraj for Hammond and Eberhard. These four members are the founders for the ESI, main pillars of the ESI for the Employee State Insurance Scheme. ESI Act was passed in the year of 1948. So here in these options, option B is the correct answer. Next we will move on to question number 11. In India, most of malaria cases are reported due to. In India, malaria cases are reported due to the which of the organism. We will see here options. Option A Plasmodium malaria, option B Plasmodium ovale, option C Plasmodium vivax, option D all of the above. Multi-organ involvement or dysfunction is reported in both Plasmodium falciparum and Plasmodium vivax cases. Most of the malaria burden is borne by economically productive gas. Malaria is a potentially life-threatening disease caused by parasites. The parasites are Plasmodium vivax, Plasmodium ovale, Plasmodium malaria. So, in India, most malaria cases reported due to the Plasmodium vivax. So here in these options, option C is the most of malaria cases are reported organism for the malaria, Plasmodium vivax. Next we will move on to question number 12. The noise level best for normal conversation is. What is the noise level? Normal noise levels best for the conversation. Options. Option A 90 dB. dB means decibels. Option A 90 decibels. Option B 60 decibels. Option C 30 decibels. Option D 80 decibels. Sound's loudness is measured in decibels. Normal conversation is about 60 decibels. A lawn mower is about 90 decibels and a loud rock concert is about 120 decibels. The normal noise levels at home not exceed 20 decibels. The normal decibels at home. The normal noise levels is 20 to 30 decibels at home. But the noise levels best for the normal conversation is option B 60 decibels is the correct answer. Any sound at or above 85 decibels is more likely damage your hearing over time. Researchers have found that people who are exposed over long periods of time to noise levels more than 80 decibels are higher at much greater risk of hearing loss. So here in these options, option B 60 decibels is the normal conversation of noise levels. Next we will move on to question number 13. One ASHA cover the population is. One ASHA covers the population. We will see here options. Option A 3000, option B 1000, option C 2000, option D 5000. What is ASHA? ASHA. ASHA means accredited social health activist. ASHA means accredited social health activist. ASHA and Anganwadi workers are denied government employment and are instead classified as honorary voluntaries under their respective scheme documents. The general norm will be one ASHA worker for 1000 population. ASHAs will be selected as rural areas. The other community voluntaries built under other government schemes can also be utilized for these purposes. One ASHA covers the population in the community is option B. 1000 is the correct answer here. Option B. Next, we will move on to question number 14. Which of the following is a water-borne diseases? From the following, one is the water-borne disease. Options: option A, filariasis; option B, poliomyelitis; option C, dengue fever; option D, all of the above. We will see one by one. Option A, filariasis. What is filariasis? Filariasis is a wide range of mosquitoes can transmit the parasite depending on the geographic area. So, spread from person to person by mosquito. Filariasis main cause is mosquito bite. So, here in this option, option A is not waterborne disease. Next, we will see option B, poliomyelitis, a virus that may cause paralysis and is easily preventable by the polio vaccine. The mode of transmission poliomyelitis is through contaminated water or food or contact with an infected person. So here in this option B is waterborne disease. So here option B is the correct answer. Next, what is dengue fever? Dengue fever is also called as break-borne fever, a mosquito-borne viral disease occurring in tropical and subtropical areas. The mode of transmission of dengue fever is through the bites of infected Aedes species mosquitoes. So this is also one of the mosquito bite. But here in these options, option B, poliomyelitis is a waterborne disease. So here option B is the correct answer. Next we will move on to question number 15. Simple random sampling is a type of. The simple random sampling is a type of. We will see here options. Option A, convenient sampling. Option B, non-probability sampling. Option C, sputum sampling. Option D, probability sampling. Simple random sampling is a type of probability sampling in which the researcher randomly selects a subject of participants from a group or from a population. Each member of population has an equal chance of being selected. Data is then collected from as large a percentage as possible of this random subset. Simple random sampling is having four types: simple random sampling, stratified random sampling, clustered random sampling, systematic random sampling. Simple random sampling is type of probability sampling. So here in these options, option D is the correct answer. Simple random sampling is a probability sampling. Next we will move on to question number 16. National Goitre Control Program was launched in the year. The National Goitre Control Program was launched in the year. We will see here options. Option A 1952, option B 1962, option C 1967 and option D 1957. In 1962, the Government of India implemented the National Goitre Control Program, now called as the National Iodine Deficiency Disorders Control Program, NIDDCP, National Iodine Deficiency Disorders Control Programs. In the year of 1982, the government made a policy decision to iodate all eligible salt in India by the 1992. So here National Goitre Control Program was launched in the year of 1962. So here option B is the correct answer. Next we will move on to question number 17. Dengue fever is due to the bite of. dengue fever is due to the which of the bite? We will see here options. Option A, Aedes albopictus. Option B, Aedes aegypti. Option C, A and B. Option D, none of the above. Dengue viruses are spread to people through the bite of an infected Aedes species. Example for the infected Aedes species is Aedes aegypti or Aedes albopictus. So here in these options, option A, option B, both are can cause the dengue fever. So here option C is the correct answer. So the mode of transmission is the bite of infected mosquito to person. So here in this option C is the correct answer. Next we will move on to question number 18. The other name of leprosy is. The other name for a leprosy. We will see here options. Option A, encephalitis. Option B, hepatitis. Option C, lathyrism. Option D, Hansen's disease. Leprosy is an infection caused by slow growing bacteria called as Mycobacterium leprae. It can affect the nerves, skin, eyes, and discovered by Dr. Gerhard Hansen in 1874. He saw the leprosy bacillus under the microscope and provided that leprosy was an infectious disease. So here in these options, the other name of leprosy is Hansen's disease. Option D is the correct answer. Next we will move on to question number 19. World Tuberculosis Day is celebrated on which date? The World Tuberculosis Day is celebrated on. We will see here options. Option A, March 20. Option B, March 24. Option C, May 20. Option D, March 21. Each year we recognize World Tuberculosis Day on March 24. This annual event commemorates the date in the year of 1882 when Dr. Robert Koch announced his discovery of Mycobacterium tuberculosis, and the World Tuberculosis Day is in educate the public about the importance of tuberculosis around the world. So here in these options, option B, March 24th is the correct answer. Next we will move on to question number 20. This is the last question in this video. Which of the following was not the priority of first year plan? The which of the following is not given priority for the first year plan? Here options. Option A, control of malaria. Option B, control of communicable diseases. Option C, health care of rural population. Option D, safe water supply and sanitation. In the first 5 years plan in India was from 1951 to 1956. The plan focused on the Harud-Domar model. First year plan, rapid industrialization, growth with stability, power and transport, agriculture, price stability, self-generating economy, healthcare about population, safe water supply. The first 5 year plan launched in the year of 1951, which mainly focused on the development of primary sector. The aim for the first 5 year plan is agriculture development. So here in this option, which is not following was priority of first year plan is option B, control communicable diseases is not a priority in the first year plan. Control of malaria, health care of rural population and safe water supply and sanitation. These all are comes under the first year plan. This is the last question in this video. Next, from the 21 question to further question we will discuss in the next class. So this is part 1 related to the Community health nursing. This is part 1. Introduction related to the community health nursing and definition. Community health nursing process, health assessment, epidemiology and epidemiology principles, methods, objectives, healthcare system, healthcare team. This is part 1 related to the community health nursing. Next we will continue from the 21 question to further video. Thank you for watching my video. Anybody first time watching my channel, please subscribe my channel. Click on the bell icon for further notification. Please share your opinion in comment section and please give a like. Stay tuned friends. Thank you.